Implants started to come on the scene probably about 30 or 35 years ago. And I took courses on that, and I said, that's something I want to do someday, and get rid of the fixed bridge and get back to having my real tooth back. But my problem was that I had busted all that bone out in that accident, and there was no bone there to put an implant in. And in those days and age, they didn't have ways of placing bone back in there. And as things developed over the next 10 years, they developed bone grafting techniques to add bone back to where there was no bone. And I volunteered when some of the specialists in my area started thinking about taking classes of bone grafting. I volunteered and said, hey, use me as a patient, and we'll do that. And at the point, it was pretty experimental at that time. It took about 5 years to get through all the bone grafting and stuff, but we eventually got enough bone there after about 4 or 5 years. And I think it was 5 or 6 different surgeries. Had enough bone there to place an implant. So I had an implant placed, and then I had a tooth built on that. And that was the best thing that I've ever done. I got rid of the bridge. Now I can floss, which with the bridge I couldn't floss there very easily. Had to do all kinds of special stuff. And it's just like having my own tooth back. And that was the best thing I ever did. And I've had it for about 15 years now, and I would do it again in a heartbeat, even if I had to go through all of those other experimental surgeries and stuff. But today, just one surgery to build the bone back up and another one later, or possibly even that one to put the implant in, would take care of that. So today it's maybe a 3 to 6 months procedure instead of a 5-6 year procedure. And it's the best thing that I've ever done as far as how I feel about my mouth and the comfort and my ability to chew and eat and speak without having problems.